Now, a controversial cut to health care coverage for some undocumented individuals was made in Governor J.B. Pritzker's recent budget proposal. The cut impacts undocumented adults ages 42 to 64. However, coverage for those 65 and older will remain intact. The move has sparked backlash from the General Assembly's Latino caucus, as well as immigrant advocates. Meanwhile, an audit released yesterday shows the program's costs far exceeded initial estimates. Joining us now with more on Zoom are Representative Travis Weaver, a Republican lawmaker from Peoria, and co-chair of the Latino Caucus, State Representative Norma Hernandez, whose district includes the communities of Melrose Park, Franklin Park, and North Lake. Thank you both for joining us. Norma, I want to start with you. You've been a very local supporter, a vocal supporter of the measure. Why do you back these programs?
Yeah, I mean, these programs are so important. Healthcare access is a human right. When this program was created, it was to meet a crisis, right? Essential workers were at the forefront. They were dying at higher rates. And this was a way for us to bring people the right to access to healthcare where it's not going to put them in debt or deter them from getting the health care services that they need. And I believe that cutting that program is taking us away from the conversation of universal healthcare. We shouldn't be, and on top of that, it actually costs the state more money to treat people who are sicker. So taking away that preventative measure, access to care would really harm not only the individuals that are enrolled in this program, it's a little over 32,000 people, but it will also cause, issues to the safety net hospitals, Cook County Hospital, all of the FQHC hospitals across the state. So this is going to really impact, and people will continue to be sick. They will continue to go to the ER, and that will cost both the patient and the hospitals more money.
And Travis, you don't support the measure. Why?
Yeah, that's right. I've been against this program from the very start. I just don't think it makes a lot of sense. You think about Illinoisans that are here legally, Illinois citizens, they don't get free healthcare. I don't think it makes a lot of sense that we would give free healthcare to people who are here illegally. But besides the merits of the program, now that we had this audit finding, I think it needs to be cut immediately at all levels. I think the governor has known about this for a while, and that's why he didn't include it in his budget proposal. But when you see things like 7,000 recipients have a Social Security number, they lied and shouldn't have ever been in the program. Another 700 enrolled were in the seniors program, and the audit showed that they were actually under 65. They should have never been in the program. Another 500 double dipped in multiple programs, and another 400 have been here for over 5 years, so they should have been in Medicaid. I think the governor knew that this was really the Titanic of programs. He should have shut it down as soon as he knew that. I don't know when that was, but clearly it was before the State of the State budget address. Yet here we are continuing to spend money on a program that we know is ripe with waste, fraud, and abuse.
Norma, what are your thoughts on what Travis is commenting, what he's saying?
Yeah, I mean, I disagree with him. I think that we do have checks and balances, which is why this audit was created. And this gave the governor's office and their team a way to develop new measures to kind of make this program less costly. For example, they shrunk the program, right? They eliminated parts of that where they added redetermination. They've also have been able to get federal, match dollars for this, along with pausing the programs for new applicants to enroll and removing LPR, which are legal permanent residents who now qualify for marketplace insurance. And I think that we also have to be mindful that this was a very new program that was developed first in the nation, right? Leading healthcare access across the country for all. And people who have legal status here also have different forms of Medicaid options that qualify. This program also had its restrictions. It wasn't available to just everyone. So we have to talk about that in that context, because there was measures taken to make this program more affordable where it doesn't impact our GRF as much, right? There is a reality that this population specifically does contribute to our economy greatly, where we will not survive without this population. And there is another reality that healthcare is a human right, and we should not be moving in the direction.
Mm-hmm. And Travis, how do you address the concerns of? Go ahead.
Yeah, I don't know that anything I really said is anything that can be disagreed with. I'm just quoting numbers directly from the audit finding. We found tremendous waste and fraud and abuse within this program. For example, in 2023, the estimated cost of it was $220 million. The actual cost of it was $645 million. That's a 290% spending overrun on the program. I think we've known that there's been waste, fraud, and abuse in this for a while. That's why we get that cost overrun. And furthermore, you think about a program that's cost Illinois $1.6 billion, a lot of that on fraud, but still $1.6 billion price tag. I mean, wow, just imagine what we could have
And,
done for Illinoisans in terms of tax cuts and property
and
tax
Travis,
relief and
I
paying
want to
down the
bring up another
maintenance backlog
question.
and paying down debt.
I want to bring up another question. How do you address the
Yeah.
concerns of immigrant advocacy groups that say this cut will leave tens of thousands without essential Medicare?
Well, what I would say to that is that there's Illinoisans that are facing a similar challenge, and I'm a strong believer that we need to be focusing on Illinois citizens. I don't believe that people are illegal, but I believe that people do illegal things. And the reality is we've got to be focusing our attention on Illinois citizens. And when you see a bill of $1.6 billion, look, Illinois families have to budget themselves. They can't spend more than they take in. Here in the state of Illinois, we spend more than we take in. That's why there was debt and gimmicks in the governor's budget proposal. And so I think that we got to tighten the belt. And part of that means that we need to cut programs that aren't focusing on Illinoisans that are full of waste, fraud, and abuse.
And Norma, you did mention, as we know, that undocumented individuals do pay taxes. Why do you think people should care about the well-being of non-citizens?
Because it impacts us if we don't care for them or if we do. This program was supported by hospital professionals, healthcare professionals, and advocacy groups. And we all know that if you provide someone healthcare, especially early on, preventative care, will actually save the state money over time. And it's also a humane thing to do. We have to remember that when this all got started, this was during the pandemic, when folks of this population were dying at higher rates, we were meeting a crisis. And when you meet a crisis, you tend to overspend because that is a reality of when that crisis exists. And if we don't take care of our neighbors' health, it does impact our own health, and it impacts our entire society because we interact with all of these systems. And when we work together to actually find a solution, this was a way that we were able to get a collaborative decision from multiple members and to figure out this issue where people were dying, they didn't have access to basic treatment and healthcare, and we needed to meet those needs. We had ARPA funds that were there as well, and we were able to develop a program that met those needs during those times. And given the amount that, because clearly more people were enrolled, that also should signal the red flag that there is a really high need here. And why are we not moving towards a direction where universal healthcare access should be our biggest fight right now? Why are we allowing corporations, companies to overcharge us where this country, which is the richest country in the world, still cannot provide access to healthcare to everyone?
And Travis, we only have a couple seconds. Any final thoughts?
Yeah, I would just say I think it's ridiculous to say that just because I don't agree with this proposal means that I don't care about immigrants, that I don't care about people. When people are getting raped and sex trafficked at the border, or we have fentanyl pouring across our borders, I don't blame the other side and say that they're heartless. I think we have a disagreement of opinion, of priorities. And I definitely care about people. I'm a Christian man. I believe in my Christian values. So I don't think that that's very fair. I do think that we need to prioritize Illinois citizens. We need to relieve our tax burden. We need to leave Illinois in a better place than we found it so that the next generation can be prosperous here.
Well, thank you both. We have to leave it at that.